I'm going to talk about clinical management of patients or of nutrition. And I've already made mention that nutrition is very important and key to healing, to maintenance of health. We all need to try to eat a little bit better. I'm going to draw your attention to the ChooseMyPlate.gov. Many of us, at least, were raised with the pyramid. Okay, and when we get into class, we're going to do some looking around on this website and talk a little bit more about what types of guidelines that they really are putting out there for us to try to eat healthier. And if you look at this plate, I don't know if any of you have ever gotten an actual one of these plates and shows you how big the plate is. A lot of times our plates that we use at home are bigger than the portion size we should be having. So if you look at the plate, vegetables is a larger portion. They tell you to do a variety of different colors of vegetables throughout the day, that the majority of that side should be vegetables, and then fruits. Whole grains should be a larger portion. Instead of using things like white bread and things like that, we should concentrate on whole grains. And then small amounts of protein, meaning 3 ounces or portion control. And then some dairy product. Okay. So myplate.com basically is aimed at preventing chronic health issues. They want us to limit saturated and trans fats, sugars, and salt, because they're finding that those are the things that lead to coronary artery disease. Salt is something that individuals that have heart disease should be limiting to 2,000 milligrams a day. And we'll take a look at some of the food labels and things out there to kind of really get a good feel for how much sodium is in a lot of the products that we have. Okay. So physical activity, what is spoken about in your book is physical exercise for 30 minutes most days of the week. If you're trying to lose weight, it does pinpoint that you need to probably double the amount of exercise that you're doing to actually lose those pounds. Okay. Clinical management and collaborative interventions. Treatment strategies a lot of times will depend on the underlying condition. So, for example, if somebody has diabetes, they're going to be limiting carbohydrates. You're going to see you're going to see us nurses counting carbohydrates, and patients are going to be taught to count carbohydrates and limit the amount of carbohydrates they have in a day. Back when I first started in nursing, it used to be food exchanges. And now we've gone to where individuals are actually on carb counts, and they base the amount of insulin that they give themselves on the amount of carbohydrates that they have. Also thinking about patients with congestive heart failure, these patients will maintain fluid, so we have to keep their sodium intake at a minimum in order for for their urinary system, gentle urinary system, to be able to expel that. Sodium, you need to remember, water stays where sodium is. Okay. Other things that you'll see, there's other strategies include dietary interventions. Lots of groups like diabetes support groups, things like that. There's nutritional classes that people can go to. And again, I talked about getting a dietitian involved if we're not sure exactly what it is that we should be discussing or implementing with our patient. Okay, this would be considered a collaborative intervention for us to do this. Other things that you'll see as far as is lipid screenings, blood glucose screenings, BMI screenings, lipid screenings looking at the HDL and the LDL, blood glucose looking at whether a person is diabetic, and BMI, those are the things I talked about in previous slides that determine obesity, can also help determine being underweight. Infants a lot will, as far as the types of tests that they will do with them. When children are born, they will automatically check their glucose just because sometimes their bodies aren't able to maintain it. They'll do a PKU and maple syrup urine disease, which is looking for enzymatic deficiencies, meaning that the bodies, if they have this, their bodies are not going to be able to break it down like they should. Okay. Medical nutrition therapy I talked about already. Basic therapeutic diets that you're going to see. Low salt, and sometimes you'll see no added salt. Low salt, usually less than 2 grams a day, and we're going to take a look at some packages. I want you to go see if you have a package of ramen noodles and look how much the sodium is in the little packet that comes with that. You'll also see low-fat diets, and sometimes you'll see this as cardiac diets, where it's low salt, low fat, meaning reduced saturated fatty acids within the food that we eat. So we're going to be looking at more lean meats, things like that. Calorie reduction are other diets that you're going to see, and then consumption of fiber. You may also see other things such as bland, soft diet, different things, and we'll go into that a little bit more when we get into the lab on nutrition. Consumption of fiber is important though. Dietary supplements that you'll see sometimes, you'll see patients that'll have things such as Ensure. Their lab work has been evaluated by dietitians and they don't have what they need with what they're eating. Maybe they're not eating enough. So you'll see where orders are given for the nursing staff to ensure that the patient drinks maybe a protein shake, something like that, to supplement them. Tube feeding is used when the patient has the inability to eat or swallow. Maybe they don't have teeth, they have a lot of cavities, but sometimes as we get further into different types of disease processes, patients with Alzheimer's, patients with Parkinson's, patients that have had strokes, they lose that inability to swallow and they end up with aspiration pneumonia. Okay, so they're not able to swallow their food, which affects their nutrition. So sometimes they'll put an NG down their nose, what we call a Dobhoff, which is temporary feeding tube, or they'll put a PEG or a J tube in their stomach. Okay, parenteral nutrition is something else that you're going to see used. So parenteral nutrition is through the IV, and they will use things such as electrolytes, insulin, different kind of things in the fluid, and then you will see lipids, which is the protein for the patients. And a lot of times this is used if the person's stomach is having to rest. I'll tell you a story about my father who ended up in the hospital for 3 weeks where he almost lost his small bowel. He was on TPN and lipids for about that entire 3 weeks because they needed to allow his small bowel to rest and try to resume its normal function. Okay. Surgical interventions that you may see in regards to nutrition, bariatric surgeries. This is where your people will go in and actually take a portion of the stomach and almost reroute it. Okay, so it's used to control obesity as well as diabetes. They found a huge link with obesity and diabetes. I have known and seen and heard of individuals that have had bariatric surgery that were diabetics prior to the surgery, were able to lose weight and are no longer considered in that realm of being a type 2 diabetic. Okay, so you have some that are non-malabsorptive procedures and some are malabsorptive procedures. What this means is you look at the root and why, which it mentions in your book. This is where the small intestines and the stomach are bypassed. Okay, so this creates an absorptive type of an issue in some people. They will lose the intrinsic factor in their stomach, so they may have to go on B12 injections. Okay, the banding that I've heard of is more of it doesn't cause as many problems with absorption of nutrients. Common complications of this type of surgery, infection. I've seen wound or surgical incision dehiscence. Nutrient deficiencies, where you'll start to begin to see macro and micro deficiencies, and and the big thing is that people will not adhere to their dietary and supplemental restrictions. Anybody that has to have this particular surgery has very strict, it's almost like a boot camp that they have to go to ensure that they're going to be compliant with bariatric surgery. Okay. And then pharmacological agents, weight loss medications. The biggest thing we want to make sure is that individuals who are taking weight loss medications are under the care of a physician whenever they're on those. Some medications that they prescribe, there's some antidepressants out there that people will be on that will actually help to reduce and help them to lose weight. Anti-lipid agents such as atorvastatin, florvastatin, anything with statin, okay, is going to be an anti-lipid agent which helps to reduce the LDL, may work on the triglycerides a little bit, and the LDL is what we call the bad cholesterol, that you'll hear a lot of people or a lot of things in the news say that if we eat high saturated fatty acids, this is going to bring that LDL up. Micronutrient supplements such as multivitamins, niacin, and vitamin B. You'll see a lot of people in the hospital that are on multiple vitamins. And then parenteral nutrition, I spoke a little bit about already, which was the TPN and the lipids. This concludes this particular lecture.